Namaste. The Apollo Hospitals Health of the Nation 26 report is one of India's most comprehensive health data sets, drawing insights from health checks that have been done at Apollo hospitals across the country. What makes this report very powerful is not what it just reveals, but what it uncovers before symptoms even begin, and it's very relevant to each one of you. Today's discussion highlights one finding which came up in the Health of the Nation report, the silent risks that we miss correcting when we rely only on routine blood tests. So, to help us to decode this, I'm joined by Dr. Amey Sonavne, who is a senior consultant gastroenterologist and hepatologist from Apollo Hospitals, Navi Mumbai, with over 16 years of experience specializing in the diagnosis and management of complex gastrointestinal and liver disorders, with strong focus on particularly hepatology and liver transplantation. He delivers advanced patient care across the spectrum of digestive health. Thank you so much, Doctor, for joining us today. I just want to begin with this insight that we have got from the Health of the Nation Report 2026. Nearly 3 in 4 fatty liver cases had completely normal blood tests. The standard liver panel that we have, the blood tests, do not always pick up early liver disease. And even it was found that people with advanced fatty liver, grade 2 or 3 also, there were almost about 59% who did have a fairly normal blood picture. So I just wanted to begin by asking you, when patients have these normal blood reports, so many people think that the blood reports give the whole picture, and there's often a strong sense of reassurance. So how cautious should people be in interpreting just isolated tests, normal blood results, without additional either medical advice or further consultations with the doctors, or other tests like supported imaging?
First of all, greetings from Apollo Navi Mumbai. As you rightly pointed out, is that the Apollo 2026 data reinforces what we see clinically. Biochemistry underestimates disease burden. So when we look at fatty liver disease per se, you may have fat storage in the liver, but only when the fat storage causes inflammation is it picked up in the blood reports. So the blood reports rising transaminase levels may not really give you a full picture of the understanding of the liver disease. It may just tell you inflammation, but it will not tell you whether there is availability or the accumulation of fat in the liver or no. It will not even tell you about fibrosis in the liver. So there has to be more clinical insight in terms of more lab investigations to really understand what the real picture is. Only few lab tests will not reveal the complete diagnosis. So a normal report does not mean no current biochemical injury. It, it does not reveal the real picture what the liver has.
And do you think this is applicable to other organs as well? Because I think another finding also was that even patients who did not have any symptoms, who had normal lipid profiles and such, also did have early silent plaque. So on the cardiac side as well, I think that applies to many other organs as well.
Absolutely. So any underlying plaque in the coronaries, any plaque formation or any atherosclerotic plaques happening in the coronaries will not be picked up by the blood test per se. It will just tell us that there is some abnormal lipid profile, but that does not indicate how much plaque is already formed inside the coronaries. So what's happening beneath the surface? Subclinical inflammation, insulin resistance, endothelial dysfunction, tissue remodeling, all of which is very poorly captured by the routine blood tests.
So, do you think this is more like a policy question that I'm asking you? Because when we say in our country a master health check or a complete health check, uh, this is something which is promoted across different organizations. It might not be even hospitals, it might be clinics, it might be labs. So, there are many such institutions offering, but I don't think all of them are equivalent in the sense that I know that in Apollo, when we talk about a health check, it is carefully designed to include all elements which would basically provide a complete information about the person's health. And I'm sure there are other organizations doing the same. But there are these many places where people go for a so-called check, but it is either not comprehensive enough. So do you think what should, like people look for? So that's the basic crux of today's chat is like, what would you like to tell people that, it is first of all great that you have decided to have a health check because that's again a whole lot of people who don't bother or who say they're too young or they don't need it. They find, okay, you've decided. But don't you think it's important to decide also where and how you're going to have this health check and what are you going to do year after year?
So what happens usually when people do health checks across, I'm not talking about Apollo hospitals outside, the current model is lab centric, but disease is risk and structure driven. So a modern risk-based model should include clinical risk profiling, which would include age, BMI, waist circumference, family history, lifestyle, diet, alcohol, sleep, activity, everything should be a part of it. Not only the biochemical test that we do as baseline, but it should also include imaging, which is the key gap today. Not most of the comprehensive health tests that are done outside include imaging as a part of the comprehensive health check. So a liver ultrasound, a fibroscan, maybe a CAC score for the coronary artery calcium scoring, maybe a carotid IMT can all fill the gap in. So it should also include functional or metabolic markers like insulin resistance markers or VO2 max. So there is definitely a shift that is required from panel-based screening to personalized risk mapping. That's what is the need for the today.
And of course, the history is important. The family history is important. I think, that is kind of, I feel that there should be a standardization of what people mean when they say it's a health check. So that's a very valuable point, doctor. So I also wanted to ask you this about, we did speak about this normal report and people saying that my blood tests are normal, so I must be healthy. And that then leads to taking only that abnormal parameter. So if my triglycerides alone are abnormal, then I will just repeat that next year. So I would like you to advise our viewers on, what the right approach is. Of course, we spoke about comprehensive nature of a health check, but why should you not think that, I will only go and repeat my abnormal value, or I will only do, certain things again and again, or I will interpret it myself. So these are very common behaviors that we see.
So when reports are normal, they test only a part of your health. What a normal report essentially means is that there is no detectable abnormality in the parameters tested and there is no active biochemical injury. But it does not rule out fatty liver, fibrosis, subclinical atherosclerosis in terms of the heart disease, insulin resistance, early CKD. Many endocrine and metabolic conditions are just missed, by looking at only the normal biochemical parameters. So normal tests reduce the risk, but they don't eliminate it. And that's what needs to be the bottom line and the take-home message.
And there's also this belief rather deeply ingrained in a whole section of people who think that, disease is there only when symptoms appear. So why should I go through something when I'm not having any symptoms? So would you like to explain to our viewers on why this is a fantasy?
Absolutely. So, what essentially happens nowadays is that when you have symptoms, only then you test and then you come to a diagnosis. But the reality is that diseases like fatty liver, diabetes, coronary artery disease are silent for years. So, the ideal screening model should be if there is a risk factor, you screen and then you intervene early. So, if at all you have a high BP, that does not mean you should not think that a high BP will not hurt you. If at all tomorrow you have a stroke, then you and land up in the ICU, you may end up spending much more than intervening at the early stage. So medicine should become anticipatory and not reactive per se.
What are I mean, it's of course, we cannot give a comprehensive list, but what are some of the must not miss tests that people should at least check if it's there in their health check package wherever they go?
So you should
That is
not
the
miss
basic ones.
Correct. So you should not miss certain tests, like when it comes to gastrointestinal system, a fatty liver disease screen in terms of a fibroscan should be essential part of the screening package. Not only just the blood test, but it should also include an ultrasound of the liver as well as a fibroscan of the liver. When it comes to the heart, it should also include the coronary artery score, the calcium scoring that we have, and sometimes blood pressure profiling too. Also, at the same time, lifestyle audit should also be a part of your annual health check in terms of sleep, stress, diet, alcohol. So if there is any metabolic risk that exists, we should not rely only on the blood test, but add additional tests like a fibroscan and an ultrasound when it comes to gastrointestinal or the liver diseases.
And one final question. So, as clinicians, how do we communicate the fact that, so normally when healthy people undergo a health check, what happens is that they expect that, that they do not want to be scared and made anxious. But at the same time, one cannot, and they would not be. So, supposing there are these very early markers or very silent findings that need to be followed up, how would you approach a patient without, like spooking him out, but at the same time conveying this importance?
So effective communication is the key. We should normalize but not trivialize. Like, for example, this is common but has to be addressed. That has to be driven in. So we must focus on reversibility, especially for fatty liver. We should tell the patient this is completely reversible at your stage, especially when there is early fibrosis. We as clinicians should avoid alarmist languages, like we should not say there is liver damage, but we should rephrase it like there is early fat accumulation. We should give clear, actionable steps, weight targets, diet specifics, activity goals. Everything should come in very specific to the patients. And we must define follow-up too. Like, let's reassess in the next 6 months, or let's reassess in the next 3 months. And we should give confidence to the patient. So you should use objective tracking too, like weight, waist circumference, fibroscan follow-ups. We should show them the reports if they have done a good job, show them how they've benefited, show them the improvement in the fibroscans. We should keep the goals specific, measurable, and realistic. And we should build a very good doctor-patient relationship, not just an instruction model. So that's what I mean. In normal tests are reassuring, but they are not definitive. And exactly true preventive medicine lies in identifying early risk factors, visualizing the silent diseases, and intervening before symptoms even appear.
Yes, I think that's a very wonderful point when you said do not trivialize, but at the same time, uh, say it in a very encouraging way so that, people can take note of it and take active steps. So thank you so much, Doctor, for these valuable insights. So viewers, what clearly emerges from this chat is that normal blood reports alone are not enough. They do not mean absence of disease. No symptoms also does not mean absence of disease. So these findings from the Apollo Health of the Nation 2026 report is very important because it represents a critical shift in how modern medicine is practiced. So is it from reactive diagnosis to proactive detection, symptom-based care to actual risk-based screening? And this is what you need to understand, that what we don't look for, we probably don't find. So we encourage all of you to read our full Health of the Nation report. So you could read it from our website. The entire report can be downloaded and read. The link is in the bio. And for those of you on YouTube, the link is in the description. So I encourage all of you to explore the full report and rethink how we should approach our own preventive health in today's world with all its risk factors and stress and hectic lifestyles. This is Dr. Srinidhi Chidambaram here, and thank you so much for joining in. Take care. Namaste.